Hello, 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 YouTube world. It's Miss Patty with 4YourCNA, and we're here for our live CNA game show where you can compete to win real prizes by answering 15 test-like practice questions. We do this on the first and the third Tuesday of each month at 11 a.m., and I'm so happy you guys were all able to join us today. So good morning. Hi, Helen. Hi, Glenda. Aviana, Christine, Anaral. Hey, Jen. Tortola. Stephanie. Hey, guys. Oh, I'm so excited to see all of you. Good morning. So, good morning, Catherine. Good morning, Chrissy. Hey, Amelia. Oh, we got lots of people on today. Awesome, awesome. All right, so those of you who don't know how this works, we're going to have a question on the screen. I'll read the question and the answer choices to you. You'll have about 45 seconds to lock in your answer. Fastest answer gets the most points. And the program that I use actually sits on top of YouTube, and it reads the answers as they come into YouTube. So keep that in mind. You might see it a little bit different on your screen as to the order. This is when it's received by YouTube, and that can be affected by a variety of features, and including like network speed and things like that. So keep that in mind. And at the end, it's going to tally up all the scores, and first place will get a prize, second place will get a prize, third place will get a prize, as long as you're in the United States. If you're international, right now I'm just not set up to ship international, and with all of the landscape changing so rapidly, I'm not looking to get into international right now. I'm going to wait till everything kind of equals out a little bit. So United States, we will ship out your prizes this week. So, today's topic is going to be, this is on the test plan. So, all of our game shows follow the CNA test plan. But this one is a little bit unique, okay? In that this is what we consider CNA tasks. And it's actually not. We actually have a whole category to provided basic nursing care. That has different stuff in it. And I like to bring this up because this is what people think about when they think of CNA. We think about the tasks that we do, right? Feeding, dressing, grooming, toileting, mobility, all of those things, the tasks, the skills. But interestingly enough, these tasks fall under a category called promotion of health and function. These are just basic daily things that we do for ourselves, and they actually don't fall under that category of basic nursing skills. So that's interesting, and it leads into a deeper understanding of the scope of practice and the role of a CNA. And I'm going to do a whole lesson on this soon, because there's a lot of confusion out there. We tend to think of our role as what we do, but that's not really the whole story, and we're kind of getting a little bit of an incomplete view. So stay tuned for that lesson. I think it's going to be really interesting for a lot of people, but this test plan actually hints at that. So today's test plan, this is going to make up the majority of the test questions. So most of the test in the categories, this one has the most questions on the state exam, and it's promotion of function and health of residents. And this is going to encompass feeding, dressing, grooming, toileting, dressing, all those things that we do. But it's also going to cover psychosocial aspects as well. How we treat the patients, what, our communication with the patients, age-related changes, things we should expect to see. So we're going to have a lot of questions in this particular topic. And it's actually one of my favorite topics to write questions for, because it's the one that we're kind of the most familiar with. These are the things that we study in class. So it gives me a lot of opportunity to write questions. So Jen says, I feel like I haven't been in here forever. had to get switched to overnights because my overnight staff quit, so I'm usually sleeping. Jim, we're so excited to have you with us. I know I haven't seen you in a while. And welcome, and we're happy to have you. And unfortunately, yeah, a lot of people are relocating and getting into different roles. I know there's a lot of shortages for CNAs right now. All right, so you are competing for prizes. First place prize will be a t-shirt, and you're going to have a choice of t-shirt. You can choose what we call the pink heart shirt. It's a pink heart. This is Called to Care. You could choose the CNA Care Crew, which is pretty popular. You can choose the class shirt, which is the one I'm wearing today. It says 4YourCNA, but inside these letters, you can't really see it because of the lights that I have. Inside these letters are actually all of my sayings, so we call it the cheat shirt. And we also have Become Inspire Care. Now we have this on black, but we also have a version that's red, white, and blue on a white t-shirt. So if you come in first place, you're going to get to choose one of these t-shirts. So Become Inspire Care on black or white, the CNA class shirt, CNA Care Crew, or the pink heart Called to Care. So that'll be first place. Second place is the card game. Now the card game is here. It's a really fun way of practicing the principles that you need to learn for the state exam, but it can also be played by non-medical people in a rummy style game that we're going to use numbers and colors to collect sets. And some of the specialty cards are designed to derail you, so there's a lot of strategy involved too. So second place will get the card game. Third place is going to get a badge holder and some motivational gifts. And the badge holder has the 4YourCNA logo, and it can only be won by students. I do give them out to instructors, but I don't sell these badge holders. They really are kind of a badge of honor. So third place will get that badge holder. So we're going to display each question on the screen for 60 seconds. I'll read the answer choices to you, and you're going to put your answer in the chat. Now, this is super important. You only want to put the numbers 1, 2, 3, or 4. Don't put anything else. Just the numbers 1, 2, 3, or 4. Don't write anything, and it's only going to accept your first answer. So if you put 1 and then decide to change it to 2, it's not going to read the second one. It's only the first one. So kind of keep these rules in mind as we're playing. So 1, 2, 3, or 4, then hit the send button, and it'll go to YouTube, and my program will read it. Shauna says, good morning. I just passed my CNA class on to clinical. Congratulations. That is so exciting. All right. So are you guys ready to get started? Are you ready to get started? I'm hoping everybody can hear me. Yeah. So here's the thing. Good morning, Christy. I just ordered a new desk. My new computer is in. I'm super excited. I'm getting that all set up now, but this is a whole new setup for me, and I was trying to hurry and get it all put together. Like literally right before I hit the go live button, I was scrambling to get stuff put together so you guys can hear me, so that's good. We got something right, and I'm hoping you can see me. So we're going to go ahead and get started, but if you're having trouble, please let me know so I can troubleshoot this, okay? All right, here we go. We're going to start in 30 seconds. So warm up your fingers, get a drink, do what you need to do, because we're going to start the questions in about 20 seconds. Good morning, Lordy. Good morning. All right, here we go. 15 questions. We're going to start with question number 1. What should be prioritized when providing personal care to a resident? 1, the CNA schedule. 2, encouraging independence. 3, discouraging self-care. Or 4, maintaining the facility's routines. So what should be prioritized when providing personal care to a resident? 1, the CNA schedule. 2, encouraging independence. 3, discouraging self-care. Or 4, maintaining the facility's routines. Go ahead and lock in your final answer. Remember, it's only going to read your first one. Lock in your final answer. You've got about 5 seconds left. The right answer here is encouraging independence. Yeah, this one you guys all got right. This was an easy one. And it's important that we understand this because sometimes we can get all caught up in our schedule or the facility's routines. It's really easy to just go in and do something for a patient because sometimes they're slow when they're trying to do it independently. And we just don't feel like we have the time to wait. But that's actually not the role we're supposed to play. We're supposed to prioritize their independence rather than our schedule or the facility's routines. We don't just want to go in and take over. When you do that, it actually can affect the patient's psychological well-being. Jen came in first on that one, followed by Shauna, Anaral, and Chrissy. Good job, guys. Question 2. A resident needs help with grooming. How should the CNA assist? 1, perform the grooming without asking. 2, ignore all refusals. 3, complete the grooming quickly. Or 4, offer choices and assist as needed. So a resident needs help with grooming. How should the CNA assist? 1, perform the grooming without asking. 2, ignore all refusals. 3, complete the grooming quickly. Or 4, offer choices and assist as needed. Go ahead and lock in your final answers. And you've got about 10 seconds left. Go ahead and lock in your final answers. The right answer here, yeah, you guys all got this one too. It's an easy one as well. Offer choices and assist as needed. So we have to remember above all that it's always about the patient, and that needs to be in the focus of what we're doing. So performing the grooming without asking, that's absolutely not the right answer. Even though we're assigned to do grooming, the patient has the right to refuse, and patients can refuse any task at any time. We shouldn't ignore a refusal. If the patient refuses, we need to be hands off. And in fact, if you touch a patient after they refuse, you can be charged with battery. Complete the grooming quickly. Well, yeah, our schedule, we want to complete it quickly, but it's actually not the right answer. Offer choices and assist as necessary is. Anaral came in first on that one, followed by Z-Tech, Viola, and Shauna. Question 3. Which intervention helps maintain skin integrity? 1, vigorous massages to stimulate blood flow. 2, pericare once per shift. 3, repositioning every 2 hours. Or 4, restricting fluid intake after 8 p.m. So which intervention helps maintain skin integrity? 1, vigorous massages to stimulate blood flow. 2, pericare once per shift. 3, repositioning every 2 hours. Or 4, restricting fluid intake after 8 p.m. Yeah, this is a little bit harder, isn't it? You got to think a little bit more on this one. This is very similar to a type of question that you might see on the state exam where the answers might look right, but there's something about them that might not be. So the right answer here is repositioning every 2 hours. But let's look at these other options. Vigorous massages to stimulate blood flow. Now, massaging can stimulate blood flow, but that term vigorous, that doesn't work for us. Pericare once per shift. Well, pericare is important. However, it should be done every 2 hours. So that's what makes that answer wrong. Restricted fluid intake after 8 p.m., that can lead to dehydration. So unless the care plan specifically tells you to do that, We're not doing it. But repositioning every 2 hours is something that helps maintain skin integrity and can help prevent pressure sores from forming. Catherine came in first, followed by Merlene, Chrissy, and Helen. Good job, guys. Question number 4. A resident reports constipation. The CNA is likely to be assigned which tasks to assist this patient? 1. Offer fluids and assist with activity. 2. Perform a digital removal. 3. Instill 500 cc's of a soap suds enema. Or 4. Give a laxative. So a resident reports constipation. The CNA is likely to be assigned which tasks to assist this patient? 1. Offer fluids and assist with activity. 2. Perform a digital removal. 3. Instill 500 cc's of a soap suds enema. Or 4. Give a laxative. Go ahead and lock in your final answer. You've got about 10 seconds left. This is knowing your scope of practice. So for constipation, we're probably going to be offering fluids and assisting with activity. Now, activity is actually a really important component of maintaining good bowel health. And we often overlook this in facilities, but we require the motion of our abdominal muscles to move food through our intestinal system. So if your patient isn't getting a lot of activity, isn't very mobile, they probably are going to get constipated. So offering fluids and assisting with activity is going to be very, very important. The other 3, not in our scope of practice. So we have to know what is in our scope of practice. But don't overlook the role of activity in managing bowel health. Jen came in first, followed by Z-Tech, Viola, and Shauna. Good job, guys. Good job. Question number 5. Which of the following indicates proper hydration in a resident? 1. Decreased thirst. 2. Tinted skin. 3. Reduced urine output. Or 4. Clear urine. So which of the following indicates proper hydration in a resident? 1. Decreased thirst. 2. Tinted skin. 3. Reduced urine output. Or 4. Clear urine. Go ahead and lock in your final answer. This one's a bit harder. A little bit harder. Yeah, you've got about 15 seconds left. Go ahead and lock in your final answer. Speaking of hydration. Right answer here is clear urine. Do not rely on a thirst reflex to indicate hydration status. A lot of times as we get older, our thirst reflex is going to diminish naturally. Tinted skin actually is a sign of dehydration. And reduced urine output, again, a sign of dehydration or advanced kidney disease. So these 3 do not indicate good hydration status, making sure the patient is getting enough fluids. What does indicate that is clear urine. Urine should be clear or a very light yellow if they're properly hydrated. And that's going to be a big part of what CNAs do. Catherine came in first, followed by Tortola, Christine, and Viola. Good job, guys. Very good job. Question number 6. When dressing a resident with a weak arm, the CNA should, 1. Dress the weaker arm first. 2. Only allow the patient to wear a hospital gown. 3. Dress the stronger arm first. Or 4. Insist that the patient dress themselves. So when dressing a resident with a weak arm, the CNA should, 1. Dress the weaker arm first. 2. Only allow the patient to wear a hospital gown. 3. Dress the stronger arm first. Or 4. Insist that the patient dress themselves. What do you guys think? Go ahead and lock in your final answer. You've got about 10 seconds left. Oh, you guys are all so smart. Look at you. Look at you. I have got such a good crew. The right answer here is, yeah, we're going to dress the weaker arm first. And the way we remember this is USA first. So undress strong arm first, and then dress weak arm first. And that's kind of the little memory thing that we use to remember this. So USA first. Undress strong arm first, dress weak arm first. Just because somebody has a weak arm doesn't mean that they have to be in a hospital gown. That's not a good answer. You don't want to dress the stronger arm first, because then you're making the weak one do all the work. And we don't insist that the patient dress themselves. I mean, that's why we're there, is to help them with the things that they need help with. So 2 and 4 are definitely not correct. And you probably just threw those answers away. So Catherine came in first, followed by Jen, Christine, Shauna, and Viola. Awesome. Question 7. Which position helps promote lung expansion during and after meals? 1, supine. 2, lateral. 3, Trendelenburg. Or 4, high Fowlers. So which position helps promote lung expansion during and after meals? 1, supine. 2, lateral. 3, Trendelenburg. Or 4, high Fowlers. Go ahead and lock in your final answer. You've got about 20 seconds left. So you have to know what all of these terms mean in order to answer this question. And you will have a question like this on the state exam that has to do with patient positioning. Right answer here is number 4, high Fowlers. Absolutely. And most of you guys got this one right. So the important thing that I want to bring to your attention with this question, though, is it says during and after meals. Now, when you eat a heavy meal, your tummy gets really full, and that's going to put pressure on your lungs, and it's going to help prevent good lung expansion. So a lot of times it's beneficial to patients to have them sit up for at least a half hour after they eat to promote digestion and to keep those lungs from really being infringed on by that full tummy, that full stomach. So keeping a patient upright during meals is important, but also after meals as well. So Catherine came in first, followed by Viola, Christine, and Shauna. Good job. Half done. Question 8. A resident is nonverbal but grimaces during movement. What should the CNA suspect? 1, confusion. 2, pain. 3, hunger. Or 4, resistance. So a resident is nonverbal but grimaces during movement. What should the CNA suspect? 1, confusion. 2, pain. 3, hunger. Or 4, resistance. Go ahead and lock in your final answer. You've got about 20 seconds left. We're going to pause in just a second because I want to talk about this really quickly. I've got something to say about this. Go ahead and lock in your final answer. The right answer here, yeah, you guys all got this one right. The right answer here is pain. Absolutely. You guys are right on track. But, so let me pause this real quick because I want to talk about this. When we have a resident who's nonverbal and we're moving them and they start to grimace, we need to pay attention to that. And we need to report it right away. So one of the things that, when I was writing this question, the thing that kind of came to mind is about 7 years ago, we had a young lady that was in a long-term care facility. She was unresponsive. She had had a near drowning incident in the past. She was unresponsive. And there was a CNA in the room giving her a bed bath. And she started moaning. And the CNA, thought, well, that's kind of weird. And went and got the nurse and said, hey, this patient is moaning when I'm just bathing her and she's moaning. Well, turns out the patient was actively giving birth. They had been sexually assaulted, gotten pregnant, and was giving birth, but unable to verbalize anything. And, unfortunately, there's a CNA in there who is giving a bed bath, and the patient is moaning, and the patient is actively giving birth. I mean, can you imagine being that CNA? I mean, that would just be totally wild. So if that CNA had not addressed this, had not recognized the fact that the patient is moaning, I probably ought to go, get a nurse. We got to check this out. Can you imagine? That baby would have been born in that room with absolutely no medical intervention at all. And there could have been a very serious outcome to both the patient and the child. So what we do matters. And when our patient is nonverbal, it's up to us to really kick in those observation skills and make sure that we're looking for the patient and speaking for the patient and listening for the patient. We really do need to be their eyes and their ears and everything else. Yeah, I know. Isn't that wild? And it's absolutely heartbreaking. And the worst part is that the person that had fathered this child was a nurse at that facility. And it was the nurse that everybody said there's no way this person was involved. But DNA testing showed. So be careful, guys. Report your observations. Catherine came in first, followed by Jen, Chrissy, and Shauna. I know, isn't that horrible? Number 9, a resident complains of being cold and has pale skin. What is the CNA's first action? 1, apply a warm blanket. 2, shower in hot water. 3, rub extremities vigorously. Or 4, provide a very hot drink. So a resident complains of being cold and has pale skin. What is the CNA's first action? 1, apply a warm blanket. 2, shower in hot water. Yes, Jen. 3, rub extremities vigorously. Or 4, provide a very hot drink. So go ahead and lock in your final answers. You've got about 15 seconds left. And I know you guys are all looking for the tell the nurse answer. It's not here. So now you got to figure out what the next best answer is, because there's going to be questions on the state exam that don't have notify the nurse as an answer. So in this case, we're going to apply a warm blanket. You don't want to put them in a hot shower. Showers should not be hot. They should be warm, but not hot. But if they're already cold, we don't want to undress them and get them wet. I mean, that just doesn't make any sense. No matter how warm that water is, they're still undressed and wet. We don't want to rub anything vigorously. We don't rub vigorously in healthcare, not for circulation, not for muscle cramps, not for anything. We don't rub vigorously, a light touch. And we don't want to provide a very hot drink. Now, this one might have been okay if it just said a warm drink. Might have been okay. But a warm blanket is going to do a whole lot more than a warm drink. So that's why number 1 is the right answer. Viola came in first, followed by Shauna, Jen, and Chrissy. Number 10. A resident is frequently unsteady while walking. The CNA should, 1, use a gait belt. 2, use a walker. 3, restrict the patient to a wheelchair. Or 4, notify the nurse. So a resident is frequently unsteady while walking. The CNA should, 1, use a gait belt. 2, use a walker. 3, restrict the patient to a wheelchair. Or 4, notify the nurse. This is a scope of practice question. And if you've watched any of my lessons, you will know that there is an answer here that is the right answer. And then there's a few that are supposed to throw you off the track. So think about my lessons when you're answering this. What should the CNA do? The right answer here is notify the nurse. Now, a lot of you went and grabbed a gait belt. CNAs are not allowed to make treatment decisions, including the use of gait belts or walkers. It's not in the scope of a practice to make that decision. What if this patient has a aorta dissection? The pressure of that gait belt can actually affect that. What if the patient just had open heart surgery or abdominal surgery? A gait belt is not a good solution. What if the patient has shingles along a nerve track around the side? Gait belt would not be indicated. Z-Tech came in first, followed by Helen, Catherine, and Chrissy. And the moral of this story is follow the care plan or notify the nurse. Number 11, which is an age-related cognitive change? 1, short-term memory impairment. 2, sundowning. 3, increased appetite. Or 4, increased focus and attention. So what is an age-related cognitive change? 1, short-term memory impairment. 2, sundowning. 3, increased appetite. Or 4, increased focus and attention. Yeah, this one's a little bit harder for you guys. I got answers all over the place. Go ahead and lock in your final answer. Jen says, I should have known because usually notify the nurse is always the right answer if it's listed. That's a good tip, Jen. Good tip. The right answer here is a age-related cognitive change, which means mental. Short-term memory impairment, absolutely. I've got a whole lesson on this that I teach in my classroom training. But you have to think about your brain as a memory-making factory. The newer the factory, the better the memory. So when we have an older memory-making factory, it's not going to make good memories. And this is why you can have somebody who doesn't remember that they had lunch, but they can remember where they lived when they were 10. Sundowning is not an age-related cognitive change. Sundowning is actually a disease-related. Increased appetite? No. Improved focus and attention? No. A decrease in short-term memory is what we're looking for. Shauna came in first, followed by Anarol, Z-Tech, and Christine. Good job. 12. A resident is anxious after moving into a nursing home. How can the CNA help? 1, redirect the conversation away from their feelings. 2, insist they participate in group activities. 3, tell them they should feel safe now. Or 4, encourage talking and offer support. So a resident is anxious after moving into a nursing home. How can the CNA help? 1, redirect the conversation away from their feelings. 2, insist they participate in group activities. 3, tell them they should feel safe now. Or 4, encourage talking and offer support. Got about 10 seconds left. My aunt just moved into an assisted living facility, and that's who I had in mind when I wrote this question. Yep. So the right answer here is to encourage them to talk and offer support. Absolutely. You don't want to redirect the conversation. If you're not comfortable talking about it, that has nothing to do with this. The patient needs to talk. Insisting that somebody participate in a group activity, we don't insist on anything. Some people are more social than other people. But number 3, I want to talk about, tell them they should feel safe now. Now, this kind of seems somewhat reasonable, right? They were at home. They can't be home anymore from whatever reason. Now they're in a nursing home. We're going to keep them safe. And it's kind of reasonable to think that we can tell them that, hey, it's okay. You should feel safe now. But you never tell somebody how they should feel. That's an immediate red flag. So Catherine Johnson came in first on that one, followed by Shauna, Jen, and Z-Tech. Good job. Question number 13. A resident is still sitting at a table after mealtime with food on their plate. The CNA should, 1, offer to sit with them while they finish. 2, remove the plate because mealtime is over. 3, leave them alone in the dining room. Or 4, tell them to hurry and finish up. So a resident is still sitting at the table after mealtime with food on their plate. The CNA should, 1, offer to sit with them while they finish. 2, remove their plate because mealtime is over. 3, leave them alone in the dining room. Or 4, tell them to hurry and finish up. Got about 15 seconds left. Go ahead and lock in your final answer. I thought this one was going to be harder, actually. You guys are good. Yeah, absolutely. 1, yeah, we're going to offer to sit with them while they finish. Now, let me talk to you a little bit about this, right? My great-grandmother was a number 2. She would remove the plate. If you weren't done and she was done, tough luck. Dinner is over, right? She would just go around removing plates. That's not our call here. But most people like to eat in the company of others. We tend to be very social creatures. So if everybody else is left, the patient's going to feel, some kind of way about that. So offer to sit with them and have a conversation while they eat. Some people are slower eaters, and that's perfectly okay. But we don't leave them alone in the dining room, because what if they start to choke? What if they have an emergency? And we don't want to tell them to hurry and finish up. Again, some people are just slower eaters, and that's okay. So Jen came in first, followed by Shauna, Anaral, and Catherine. Good job, guys. Question number 14. What tool can help prevent pressure injuries? 1, a side rail. 2, a chair cushion. 3, a walker. Or 4, a bedside commode. So what tool can prevent pressure injuries? 1, a side rail. 2, a chair cushion. 3, a walker. Or 4, a bedside commode. So those of you who are currently playing, and I should have mentioned this earlier, if you are not subscribed to the channel, you can play, but the system isn't going to read your responses. So keep that in mind if you're not seeing your response come up. So go ahead and answer the question. You've got about 10 seconds left. 10 seconds left. Right answer here is number 2. Chair cushion, absolutely. Side rails do not prevent pressure injuries. They actually don't promote safety either. I've got a whole lesson on that. But side rails don't think or don't do what you think they're going to do. Walkers will help with stability, but don't do anything for pressure sores. Bedside commodes can help with mobility, but don't do anything for pressure sores. Chair cushions do, because chair cushions are created in such a way that it's going to redistribute the pressure based on how the patient is positioned. So we can relieve pressure on one side by shifting the patient just a little bit, and a couple hours later we would shift them again, and that would move that pressure to another area. So Jen came in first, followed by Viola, Shauna, Anaral, and Chrissy. Last question, here it is. What is a sign of a healthy psychosocial state? 1, self-isolation. 2, sleepiness during the day. 3, social engagement with others. Or 4, avoiding meals. So what is a sign of a healthy psychosocial state? 1, self-isolation. 2, sleepiness during the day. 3, social engagement with others. Or 4, avoiding meals. And I know this one's a little bit tougher. That's why I left it till last. But you have to know what a psychosocial state is. What does that mean? And then you have to pick the right answer. You've got about 5 seconds left. Go ahead and lock in your final answer. Remember, this is our last question. The right answer here is social engagement with others. People tend to be social creatures. Now, social engagement with others, there's nothing that says prolonged or intense or frequent. It just says social engagement with others, which means this is somebody who's saying hello to other people, acknowledging them, maybe participating in activities, maybe not, but they are interacting with others. Self-isolation is not healthy. Sleepiness during the day, not a healthy psychosocial state. And avoiding meals, again, not a healthy psychosocial state. These are all indicative of possible depression or some other unhealthy psychosocial situation. Jen came in first, followed by Viola, Shauna, Catherine, and Chrissy on that question. So overall, top prize goes to Jen, second place goes to Shauna, and third place to Catherine. So let me go over here. So to claim your prizes, you're going to send me an email to 4YourCNA@gmail.com. You're going to give me your screen name. You're going to give me your real name, your mailing address, and what place you came in. And these are the prizes. First place is a t-shirt. Second place is the principal's card game. And the third place is a badge holder. And then remember, these are your t-shirts that you get to choose from, Jen. So good job, guys. I'm so excited. You guys did a fantastic job. First place, please let me know your t-shirt size as well as which one you want. So I hope you guys enjoyed this. I love doing these game shows. I love writing the questions, and they really are very, very similar to what you're going to see on the state exam. Some of them are going to be easy, and you're going to think, that's a no-brainer. And then some are a little bit more challenging, where you really have to think about the words and what they're really asking. Like, I think it was Jen that said, if notify the nurse is the answer, it's usually the right answer, but not always, not always. So I really hope that you enjoyed this. Remember, we do this on the first and the third Tuesday of each month at 11 a.m. So the next one will be in June. So the first Tuesday in June, I think I said Tuesday. Yeah, the first Tuesday in June. And we're live at 11. So if you've got any ideas for topics that you want us to present for the game show, please feel free to reach out. You've got my email. Let me know what kind of topics you would like to see. But remember, I'm sticking to the test plan. And because that's very important. Remember, this is a practice test game show. So we want to stick to that test plan. But if you've got some questions that you think would be relevant, please feel free to reach out and let us know. All right, so those of you that are following along our classroom live stream, tomorrow is graduation. I'm super proud of this group. They did a great job. So tomorrow is graduation, but this can help you too. This is the one class that I encourage everybody to tune into, because something I'm going to talk about, in addition to renewal and continuing education, is finding a job in healthcare, because it's different than other industries. And we're going to talk about how to answer that question, tell me a little bit about yourself. And I'm going to give you a formula that you can use to follow to create a tell me a little bit about yourself blurb to use, something to say that will be absolutely irresistible to your future employers. So if you have a chance, tune in tomorrow at 9 a.m. on our YouTube channel or on flcnatraining.com and watch that lesson. You can attend live, ask questions. It's just like this. And we would be happy to help you ace your next interview so you can get that position. So if you can't make it live, tune in to the replay. I hope that that you guys had fun today. I did. Thank you so much for hanging out with me in the middle of your Tuesday morning. And I hope to see you again for our next game show in June. Until next time, happy caregiving. Bye.